Greetings, my dear friend. My name is Maxim and welcome to my channel. And today we are going to be discussing fibromyalgia. Well, without further ado, let's enjoy the lecture and dive into it. A little bit of history. Chronic widespread pain has been documented since 19th century, but it wasn't until 1976 that Dr. Hench officially used the name fibromyalgia to describe this collection of symptoms. Prior to his creation, sufferers were referred to as having muscular rheumatism, fibrositis, psychogenic rheumatism, and neurasthenia. Eventually, researcher Muhammad Yunus proposed the term fibromyalgia as a synonym for fibrositis, and it was later published in 1981. The word fibromyalgia is derived from Latin fibra and Greek myo and algos, words meaning fiber, muscle, and pain. Smith and Moldovsky's 1977 paper on fibrositis is regarded as central in historical perspective on the development of the fibromyalgia concept. In 1981, the first clinical controlled study of fibromyalgia symptoms was published, confirming that symptoms are correlated. Studies of the first proposed medication of fibromyalgia were published in 1986, and an interconnection was proposed between fibromyalgia syndrome and other similar conditions in 1984. A 1987 article in the Journal of American Medical Association used the term fibromyalgia syndrome while describing it as a controversial condition. In 1919, the American College of Rheumatology (ACR) published the first classification criteria for fibromyalgia. In 2010, 16, and 19 revisions were made. Fibromyalgia is characterized by chronic widespread pain, fatigue and sleep disturbances, cognitive issues, abdominal cramps and pain, depression and hypersensitivity. Numerous possible factors can contribute to the condition, such as genetic predisposition, psychological stress, physical trauma and particular infections. Moreover, it is believed that the disorder involves processes in the central nervous system resulting in something known as a central sensitization syndrome. Signs and symptoms include chronic widespread pain, fatigue and sleep disturbances as the defining symptoms of fibromyalgia. In addition, there may be cognitive difficulties, musculoskeletal stiffness, environmental sensitivity, hypervigilance, sexual dysfunction, and visual symptoms. Pain could feel like an ache, a burning sensation, or a sharp, stabbing pain. There are two types of fatigue associated with fibromyalgia: physical and mental fatigue. Physical fatigue can be demonstrated by a feeling of exhaustion after exercise or by limitations in daily activities. Sleep problems. Sleep disturbances are typical for fibromyalgia and involve difficulty in both falling asleep and remaining asleep, as well as feeling tired after waking up. A meta-analysis comparing objective and subjective sleep parameters between those with fibromyalgia and healthy individuals exhibited poorer sleep quality, efficiency, longer wake-up time after beginning to sleep, and shorter sleeping duration correlated with a high risk of initiating sleep issues in fibromyalgia sufferers. These problems could be predisposed by decreased release of IGF-1 and human growth hormone, leading to inhibited tissue repair. Improving sleep quality is considered beneficial for minimizing pain in those living with fibromyalgia. Cognitive problems. Many people suffering from fibromyalgia struggle with cognitive difficulties, often referred to as fibro fog or brain fog. A recent study has found that almost half of fibromyalgia patients have subjective cognitive difficulties associated with high levels of pain and other symptoms. The American Pain Society recognizes this issue as a major factor of the condition, expressing itself in concentration problems, forgetfulness, and slow, disorganized thinking. Approximately 3/4 of individuals with fibromyalgia report considerable issues regarding concentration, memory, and multitasking. A 2018 meta-analysis further disclosed that the most notable differences between persons suffering from this syndrome and healthy subjects are in terms of inhibitory control, memory, and processing speed. It is suggested that the increased pain negatively impacts attention symptoms, leading to such cognitive detriments. Hypersensitivity to bright lights, loud noises, perfumes, and cold, in addition to their hypersensitivity to pain. Researchers found that they have a lower threshold for cold pain, and acoustic hypersensitivity has also been documented in other studies. Comorbidity. Fibromyalgia is an uncommon diagnosis on its own, as most patients also suffer from overlapping chronic pain issues or mental conditions like anxiety, post-traumatic stress disorder, bipolar disorder, alexithymia, and depression. Individuals with fibromyalgia are 5 times more likely to experience major depression than the general population. It also often coincides with multiple headaches, myofascial pain syndrome, and temporomandibular disorders. Other neurological conditions associated with fibromyalgia include multiple sclerosis, post-polio syndrome, neuropathic pain, and Parkinson's disease. Fibromyalgia additionally overlaps with chronic fatigue syndrome and may be caused by similar factors. It is reported to occur in 20 to 30% of individuals living with rheumatic diseases or non-inflammatory musculoskeletal diseases. This is likewise seen in people with celiac disease or irritable bowel syndrome. Changes to the gut biome can lead to autonomic nervous overstimulation via alternations of serotonin levels. Fibromyalgia has also been linked to obesity as well as connective tissue disorders, cardiovascular automatic abnormalities, and an overactive bladder. Genetics are a major driving force behind fibromyalgia, accounting for up to 50% of susceptibility. This is due to certain gene polymorphisms in serotonergic, dopaminergic, and catechol-aminergic systems such as SLS6A4, TRPV2, MYT1, NRX, N3, and the 5-hydroxytryptamine 2A receptor. The heritability of this condition is particularly pronounced in patients younger than 50. Comorbidity between fibromyalgia and neuropathic pain or major depression disorder likely arises from shared genetic abnormalities, impacting monoaminergic, glutaminergic, neurotropic, opioid, and pro-inflammatory cytokine signaling. In susceptible individuals, excessive psychological stress can lead to defects in both inflammatory and stress pathway related to mood and pain, eventually spurring a sensitization or kindling effect, which can trigger fibromyalgia as well as mood disorder. Stress. It has been suggested that the development of fibromyalgia may be due to stress-induced disruption of the hypothalamic pituitary adrenal axis, and a 2021 meta-analysis uncovered an unmistakable correlation between psychological trauma and the condition. Those suffering abuse in their lifetime were 3 times more likely to suffer from it, where those who experienced medical trauma or other stressors were twice as likely. Pathophysiology. Pain processing abnormalities. Chronic pain can be divided into three types: nociceptive, neuropathic, and nociplastic. The first two are related to inflammation or nerve damage, respectively, while the last is still not fully understood but often associated with fibromyalgia. It is possible for fibromyalgia patients to have multiple types of pain at once, including nociceptive rheumatic illness or neuropathic small fibroneuropathy. Nociplastic pain or central sensitization. Fibromyalgia is a condition of nociplastic pain, which is characterized by an altered function of the peripheral and central nervous system. Nociplastic pain is thought to be caused by either increased processing or decreased suppression of pain signals within the nervous system, or both. Neuropathic pain. An alternate hypothesis for nociplastic pain processes fibromyalgia to be a form of stress-related dysautonomia with neuropathic pain characteristics. This view spotlights the part of the autonomic and peripheral nerves in producing widespread pain, fatigue, and insomnia. The existence of smaller fibroneuropathy in some fibromyalgia patients corroborates the neuropathic autonomic basis of the disorder. However, others insist that this only occurs in smaller groups with fibromyalgia. Autonomic nervous system. It has been proposed that fibromyalgia may be caused or perpetuated by a lowered vagal tone, which is signified by anomalous low heart rate variability, reflecting an augmented sympathetic response. A number of studies demonstrate that clinical improvement is linked to a raised heart rate variability. Medication, yoga, mindfulness, and exercising are examples of intervention that can promote the activity of the vagal tone and heart rate variability. In 2023, the fibromyalgia imbalance of threat and soothing systems Fitts model was suggested to explain this phenomenon. According to Fitts, the mid-singular insular network, also called the Salins network, may become continuously overactive due to an imbalance in emotion regulation. This is represented by an overly active threat system with a weakened soothing system. This excessive activation, alongside other factors, might be contributory to fibromyalgia. Immune system. A role for inflammation in fibromyalgia has been suggested. Inflammatory cytokines such as interleukin-6 and 8 are higher in people with fibromyalgia, while pro-inflammatory cytokines such as IL-1 receptor antagonists are also elevated. Pro-inflammatory cytokines may increase sensitivity to pain and contribute to mood problems. Anti-inflammatory interleukins such as IL-10 is also associated with fibromyalgia. Fibromyalgia is frequently preceded by autoimmunity triggers such as traumas and infections. Neurologic inflammation has been proposed as one contributing factor. Digestive system. Microbiome of the gut. Although there is a lack of evidence, it is thought that gut bacteria may have an effect on fibromyalgia. People with fibromyalgia are likely to have dysbiosis, which reduces the diversity of microbiota. The relationship between the gut and the nervous system goes both ways. The gut can be impacted by the nervous system, but likewise the nervous system can be influenced by what's happening in the gut. Moreover, neurological effects sent via either the autonomic nervous system or hypothalamic pituitary adrenal axis are directed to intestine responsible cells that are affected by microbiota. The gut-brain axis. Researchers are also interested in the gut-brain axis, which connects the gut microbiome to the brain via the enteric nervous system. There are abnormalities in neurotransmitter metabolism in patients with fibromyalgia due to less varied gut flora and altered serum levels of glutamate and serine. Diagnosis: American Pain Society 2019 and the United States Food and Drug Administration forced a new diagnostic system which incorporated two dimensions: core diagnostic criteria plus common features. In line with 2016 diagnosis guidelines, the presence of another medical condition or pain disorder does not exclude fibromyalgia, but must be eliminated if it is the primary cause of patient's symptoms. The core diagnostic criteria for the condition are multi-site pain with 6 or more out of 9 possible sites for at least 3 months, as well as a moderate to severe problems with sleep and fatigue over a 3-month period. Additionally, typical common features often seen in fibromyalgia sufferers include tenderness, dyscognition, musculoskeletal stiffness, and environmental sensitivity, hypervigilance. Management: exercise. The European Alliance of Associations for Rheumatology has given exercise a strong recommendation as a fibromyalgia treatment due to solid evidence that it increases fitness, enhances sleep quality and overall life satisfaction, whilst reducing pain and fatigue. What's more, exercise is without any serious risks. There are multiple hypotheses regarding the biological mechanisms that cause the positive effects. It could be due to improved serotonin regulation, reduced cortisol levels, or inhibiting inflammation. Aerobic exercise can also benefit muscles by promoting metabolic pathways and lowering pain levels. Aerobics have been the most thoroughly researched exercise for fibromyalgia patients. Examples of aerobic activities include walking, jogging, spinning, cycling, dancing, and working out in water, with walking being deemed particularly beneficial. A Cochrane summary from 2017 reported that doing aerobics might enhance quality of life somewhat, lower pain levels, and result in a slight increase in physical function, having no effect on stiffness or fatigue. Furthermore, a 2019 meta-analysis revealed that keeping up a regular aerobic routine at 60 to 80% maximum heart rate for 45-60 minutes over 2 days per week could reduce autonomic dysfunction and heighten heart rate variability. In addition to these gains, aerobic exercise also has the potential to decrease depression and anxiety levels and bolster overall quality of life. Flexibility training combined with aerobic training can reduce stiffness. However, the evidence is low quality. It is unclear if flexibility training alone is effective at reducing symptoms or has any adverse effects. Resistance exercise can effectively reduce pain, anxiety, and depression, improve quality of life and treatment adherence. A meta-analysis from 2022 established that exercising twice a week at an intensity between 40 to 85%, 1 repetition maximum for a minimum of 8 weeks, was effective in symptom improvement. Low dosage is also beneficial, with just 1 to 2 sets for 4 to 20 repetitions. Intensity should be increased gradually, while some treatment regimes allow increasing when the participant can do 12 repetitions. High intensity may reduce adherence to treatment. A 2021 study found that meditative exercise programs such as Tai Chi, yoga had a major positive effect on sleep quality when compared to other forms of exercise. Subsequent meta-analysis have revealed additional benefit of Tai Chi with regard to improving fibromyalgia symptoms, pain, fatigue, depression, and overall quality of life. To maximize the effect of this exercise, a typical intervention would last for 12 weeks and comprise 1-hour session taken 1 to 3 times per week. The potential mechanism behind this favorable outcome could be attributed to antioxidation, anti-inflammation, reduction in sympathetic activity, and modulation of glucocorticoid receptor sensitivity. It is recommended to practice aquatic therapy at least twice a week using a low to moderate intensity in order to improve symptoms and wellness in people with fibromyalgia. Medications. Antidepressants are a typical form of medication for fibromyalgia, and a 2021 meta-analysis determined that they can improve the quality of life for sufferers in the short to medium term. The sole tricyclic antidepressant amitriptyline is the only one with enough evidence to support its use. However, for many patients, the potential harms outweigh any potential benefits these medications may have. Furthermore, the evidence that indicates first-line treatment with amitriptyline is lacking in quality, and comparison between different drugs is poor. Though mirtazapine has very weak evidence suggesting people may benefit from its use, outcomes are generally minimal and the risk of adverse effects remains high. Anti-seizure medication. Gabapentin and pregabalin have been suggested as a means of reducing pain associated with fibromyalgia, although there is some evidence to suggest that gabapentin may be beneficial for up to 18% of sufferers. It is not possible to predict who can expect positive results, and a trial period may be suggested. Unpleasant side effects such as dizziness and unsteady gait or fluid retention are experienced by approximately 6 out of 10 people taking the medication. With regards to pregabalin, 9% of users may benefit from it. Moreover, its use has been linked to fewer days off work each week. The use of cannabinoids may have some benefits for people with fibromyalgia, but data on the topic is limited. Cannabinoids may also have adverse effects and might negatively interact with common rheumatological drugs. Topical treatment. Capsaicin has been suggested as a pain reliever. Preliminary results suggest that it improves sleep quality and fatigue, but more research is needed. Nutrition and dietary supplements. Low-quality evidence suggests that fruits and vegetables, low-processed foods, high-quality proteins, and healthy fats may have some benefits. Vegetarian and vegan diets also have some benefits, although the evidence of dietary supplements benefits in fibromyalgia is generally poor quality. Q10 coenzyme and vitamin D have been linked to improvements in pain and quality of life. To explore the potential effect of Q10 coenzyme on fatigue, doses of 300 mg per day have been trialed for 3 months. It is thought that this could improve mitochondrial activity and reduce inflammation. Vitamin D has demonstrated mixed results when assessing fibromyalgia measures. Melatonin treatment improved sleep quality, pain, and disease impact in fibromyalgia patients. Fibromyalgia flare-up foods: caffeine, refined sugar, aspartame, high fructose corn syrup, simple carbohydrates like cake, white bread, potatoes, saturated fats, red meat, alcohol, processed foods, yeast, gluten, dairy, tomatoes, bell peppers, eggplant. The manual therapy method. In a meta-analysis published in 2021, it was concluded that massage and myofascial release were effective in reducing pain in the medium term. Other mind-body therapies had no good evidence or benefits. Electrical neuromodulation. Several forms of electrical neuromodulation, including transcutaneous electrical nerve stimulations and transcranial direct current stimulation, have been used to treat fibromyalgia. Researchers have found that they reduce pain and depression as well as improve functioning in general. Subsequent research indicated that transcutaneous electrical nerve stimulation may be effective against pain in the short term, yet uncertainty remained about its success rate. Using an implantable device to electrically stimulate the vagus nerve may reduce fibromyalgia symptoms, but it may have adverse effects. Brain stimulation without invasive methods. In neuropathic pain and fibromyalgia, non-invasive brain stimulation methods like transcranial direct current stimulation and high-frequency repetitive transcranial magnetic stimulation have been found to improve pain scores. A 2021 meta-analysis of multiple intervention types found that magnetic field therapy and transcranial magnetic stimulation might reduce pain in the short term, but the results were inconclusive. Several subsequent meta-analyses focusing on transcranial magnetic stimulation observed positive effects when treating fibromyalgia. Repetitive transcranial magnetic stimulation improved pain immediately as well as quality of life after 5 to 12 weeks. However, it did not seem to have any effect on anxiety, depression, or fatigue. Additionally, applying transcranial magnetic stimulation to the left dorsolateral prefrontal cortex was also ineffective. The efficacy of hyperbaric oxygen therapy for treating chronic pain has been noted. Yet, when it comes to fibromyalgia, the data is somewhat limited since there are few large-scale clinical trials conducted. Another factor that must be taken into account is the potential oxidative damage associated with the use of HBOT. On the positive side, a 9 trial evaluated with 288 participants showed that HBOT was more successful in relieving fibromyalgia patients' pain than the control intervention. Furthermore, in most of those trials, HBOT resulted in improved sleep disturbances, multidimensional function, patient satisfaction, and tender spots. Sadly, 24% of the patients did not experience any benefit from the treatment. Prognosis. Nearly all patients with fibromyalgia experience persistent symptoms. It is rare to achieve total relief of symptoms. In addition, the symptoms do not cause disability or shorten life expectancy. Well, folks, this is all what I have for you today. Thank you for watching. I wish you a very lovely day and see you guys later. Goodbye.